Hi, my name's Amity Herbert. I'm a registered nurse in emergency, and today I'll be showing you how to set up a Philips V60 BiPAP machine. So you need to assess whether your patient is suitable for BiPAP. Indications for BiPAP include the treatment of respiratory failures, type 1 and 2, COPD or chronic obstructive pulmonary disease. Other patient assessments we need to do before we start BiPAP is your patient willingness and participation and their consciousness, and some contraindications for BiPAP include any cardiac arrest, any facial traumas or surgical airways, and the inability to protect their own airway. We'll go over the machine. It's got a simple on-off button down here on the right hand side, and then this main screen is a touch screen, and it allows you to adjust your IPAP, EPAP, your PEEP, and all of the other functions for the patient requirements. It needs a circuit, so we have our patient face mask, which comes in a package like this, and then we've also got our circuit as well. You do need access to oxygen whilst setting it up. Your BiPAP, this don't have a patient, sorry, so I'll just explain it on myself. So over the head like so. Just going over what I did, placed it over the patient's head. We have two straps up the top to tighten here, and then we also have two clips on the side which connect into the mask. You then tighten the mask to make sure it is a snug fit on your patient. If you don't have a snug fit on your patient, the machine will alarm and let you know that there is a leak of the seal. We've got the circuit. So the circuit is some tubing. So we have two lines. We have a thicker line and a thinner line. So the thin tubing connects to our exhalation port, and the thicker tubing connects onto the side. It's got a filter. Yeah. So filter on this end, we then connect up to the patient mask, and we've got our external port here. So this is the system. So we've got our patient connecting down to our BiPAP machine. Once you've turned on your BiPAP machine, you'll need to select your settings. So initially, your first one will be your inspiratory positive airway pressure, or your IPAP. So this setting is found on the left-hand side down the bottom, and it refers to the pressure being supplied at the inspiration of your patient, which in turn reduces the effort that they need to breathe. Generally, our IPAP setting is between 8 to 12, and it is titrated based on your patient's clinical picture, including their ABGs or VBGs. EPAP is the expiratory positive airway setting. So it's the pressure at your expiration. Increased EPAP provides a stenting of the alveoli, which helps to open that airway and prevents a collapse, leading to improved oxygen exchange between the alveoli and patient. Generally, your EPAP will start anywhere between 4 and 6. Our rate here, so this is our backup rate. It's generally less than what your patient is. So if they're resping at 20
14 is a good rate, making sure they're having at least 14 breaths a minute. We have our oxygen rate. Sometimes patients don't require oxygen on a BiPAP, but if they do, we can simply change it or move it all the way down to room air, which is 21. We will titrate these as nurses and manage the BiPAP and commence it. However, we will need these to be selected by the treating physician for initial and ongoing treatment of that.
Got our BiPAP set up. Our patient is currently receiving treatment from it, so we need to make sure we do appropriate documentation, and we need to make sure that's in accordance to our local health district. So with our documentation for a BiPAP patient, we need to be looking at their IPAP and EPAP, their oxygen requirement, and their respiratory rate. We also need to maybe look at the pressure support, which is the difference between the IPAP and the EPAP, and your patient's level of consciousness. Seeing if they've got a higher CO2, they could be a bit drowsy. Post-commencement of your BiPAP, you'll need to continually assess your patient and collect regular VBGs or ABGs via an outline. And you'll need to be looking at your patient's values of those results to determine if the current settings are improving their clinical picture. If they aren't, you need to be discussing that with the treating physician. An important